fertility center, we usually do day 5 transfers. Most of our transfers are usually day 5 transfers where amazing results. So day 5 of transfer will hopefully will have generated very good quality embryos, all right, and then the patient is will come in on that day, and with the use of a transfer catheter, the under ultrasound guidance, the patient will have embryos transferred. Typically, we do 2 or 3 embryos, not more than that, and we usually expect 7 mm. So that will mean usually between 7 to 14 mm thickness of the endometrium. Once we are able to achieve that, the patient would have the embryo transfer done, and then she will continue with her luteal support, the use of progesterone. Initially, both on the day of insemination or after the day of insemination, when fertilization has been confirmed, the patient usually will start on injectables, on gestone, and then once we have done the transfer and we change, and then the patient is now on the vaginal insert. She takes that on for 2 weeks until the pregnancy test is done, and once the patient has been confirmed pregnant, the luteal support will continue with the use pastry, and then we'll also now introduce the progesterone injections. All right. I want to say the reason why we usually do suggest to patients the option of the third party, because it improves and increases your chance of success. So typically, success rate in an egg donation IVF program is higher than the traditional IVF due to the fact that you are using a younger, healthier egg in the patient than you would otherwise have done. So imagine you have a patient who is 40, who is 39, 41, 42. Compare the quality of that egg to someone who is 22, 23, 24. All right, the one who is younger obviously definitely have a higher quality in terms of the eggs, and that would translate to better embryo quality and better outcome. And that is why it's no wonder that the success rate from an egg donation program is usually between 50 and 70%. All right, and this again would also depend on the uterine health, the health of the endometrium, and other non-ovarian factor. Now, because you are using a donor egg, you most times we do achieve great results in terms of embryo quality, but sometimes we don't. Why? Because we still have the sperm quality to contend with. And then I must also say too that although we say that, oh, young, because they are younger, they should produce better quality eggs, but I've come to realize that the quality is not the same across board. There are some donors who are who have very, very good quality eggs, and there are some other donors too that have average quality of eggs. All right. For example, a donor that is polycystic, all right, that have what we call polycystic ovary, when that donor is stimulated, the quality of our embryo will not be as good as a donor